even though we see thousands of people and help them every year, there are thousands more low-income, uninsured, working people who we can't see. You know, in hearing Lisa talk, it made me kind of hope that maybe in 6 months there would be a cure for all kinds of diseases, AIDS and cancer and MS, and that would be a great thing. We certainly want to hope for that. And maybe that'll happen. But I think there's one thing today that we know can happen in 6 months, and that is that we can find a cure for uninsurance. Because it's not like people don't know what the answer is. There are plenty of smart physicians and policymakers and health economists in the country who know where the good systems are, who know where physicians can be paid well and have created systems that provide good care, good access to care at a cost that our nation can afford with choice of provider for people. And that exists already today. So it really isn't a question of not knowing what the answer is or where to find it. It's a question, it's really just a moral question of what kind of country do we want to be? So I'm really heartened to see everyone out here today. I guess I would close by saying that I really believe we can find a cure for uninsurance. I think that it's a majority of people from all political persuasions who really believe that we should care for those who are sick regardless of their ability to pay. And I think if that majority across the board stands up, then we'll be in really good shape. But we do need to act now, and I really appreciate you all being here today. Thank you.
Going to hear from offers a perspective of an independent business person. Rob Martin is a partner in Brand Sync here in Richmond. So, Rob?
Given me today to speak about health insurance reform for small business owners. I think it's a perspective that is not often enough heard, and I hope to add to the discussion today. I met many of you while campaigning for Barack Obama, and it's great to see you guys out here. Congratulations. I do want to say that health insurance reform is one of the primary reasons that I got involved in Barack Obama's presidential campaign, and I'm really happy that it's reached the point of discussion that it has today, and it's a moral and ethical imperative for our country, and I know all of you agree with that. I've had my own marketing consulting firm for 10 years, and it's right here in Richmond, and I just want to make it clear that small businesses really are not well served by the current insurance industry. It doesn't work for me as a business owner, and it doesn't work for my employees or my colleagues, and I'll explain that to you. And like many other small businesses, I can only afford to offer health insurance to a small number of individuals in my firm. At one point, I provided insurance for as many as 10 employees, but now I'm only able to do so for a small group of people. And on a daily basis, I work with contract employees. I know other small business owners are familiar with this way of doing business, and it's not really ideal. It's not ideal for the contractors themselves, who would rather be employed full-time and be receiving benefits such as health insurance. And it also isn't as good a model for the clients that we have that would rather have the companies that they employ have everybody under the same roof. But it's been necessitated for my business because health insurance has gotten so expensive that I do this where I employ the very minimal number on a full-time basis and provide them health insurance and use the rest as contractors. So these people are out buying their own insurance policies, and they don't enjoy the economies of scale that large employees of large corporations or public elected officials enjoy being part of very big insurance plans. They're out one by one without a pool to enjoy, and that is just not good business. It's not good for small business, it's not good for our economy, because it's keeping businesses like mine, which our great Senator Mark Warner, I'm sure, would agree, are necessary to turn our economy around. And I'm curious if you knew that small businesses in the U.S. pay 3 times the administrative costs of large businesses for health insurance. And healthcare reform, like the Obama administration supports, will create a health insurance exchange. I know most of you understand this concept, but to me, it's not discussed enough, and I hope that people will talk to their legislators and educate them if you agree that it's a good idea. Having a health insurance exchange will enable employers such as myself to go out and pick from plans that are competitive, and we can compare prices, benefits, and performances of health plans. And that is really not the case in Virginia right now for small businesses. There's, as it is the case in most states, there's one dominant insurance company for the small group insurance market. And in fact, in many states, as many as 70% of the small insurance market is dominated by one carrier, and that's the case here in Virginia, and you know who I'm talking about. Okay. For me as a small business owner, there has always been only one insurance company choice, because the competitors do not command the number of participants necessary to offer more affordable plans. And yet every year my insurance agent comes to me and says that our premiums have increased, and this year, once again, it was nearly 10%. And here's the letter that I just received, August 26th. Our plan renews November 1st, and I have no choice. It's this plan. It's 10%. The competitive plans, which are mentioned in here, are inferior. And this is the way it's been since I got in business 10 years ago. This one insurance company, and that's not a free market. So I have no recourse, no option to say no to that 10% increase, since there is no other insurance company offering a more affordable option to small business owners. With a health insurance exchange like the one proposed through healthcare reform by the Obama administration, competitive private plans and a public option will increase the choices for small businesses and promote competition that holds private insurers accountable. Another benefit of health insurance reform will be the tax credits that small businesses will receive to help them provide health insurance for their employees. This will make health care more affordable for small businesses and their workers, enabling small business owners to reinvest more in their businesses. And this is what I intend to do once health insurance reform comes to pass. Before ending my remarks, I'd like to talk about another more personal reason for my support of health care reform. Yes, I am here today with my wife and as a small business owner, and I'm here as a father of a child with special needs that my wife and I have taken care of for 12 years. He's on the autism spectrum, and my insurance company does not cover any expenses for autism treatment, as do any of the other insurance companies in Virginia. And they do spend a lot of money lobbying against coverage of autism services, and he does not receive coverage for speech therapy, which we have spent thousands of dollars on through the years, out of pocket. And when I go to the public schools, or the public school where my son attends, I see these other children who can't afford these expensive services, and they are desperately needed. And I can't help but think our healthcare system is broken, and it must change now. It's both morally bad